Hello, good morning. My name is Jeff. I am your nurse today. How are you feeling today? I am great, nurse. Thank you for asking. And you? I'm good. Thank you. May I know your name and date of birth, please? My name is Mr. Calvin and my date of birth is January 1st, 2001. May I check your ID band if you don't mind? Sure. So Mr. Calvin, you are due for a dressing change today. Is that okay with you? It is important to keep the dressing clean at all times, to promote healing and prevent infection. Do you feel any pain around the wound site? No, nurse. Okay, great. This procedure is going to take a while, so would you like to use the toilet before we start? No, nurse, I just went. Okay, great. Do you have any allergies to plasters and adhesives? No, nurse. So I would like to check the state of your current dressing. Is that okay? Okay, nurse. So I'm just going to close the curtains to provide privacy for you, and perform hand hygiene and don my gloves. Okay, nurse. I am going to remove the blanket, and check the dressing. I can see that the dressing is clean, but we would still like to change it. Is that okay? Okay, nurse. So I am just going to put the blanket back. I'm going to remove my gloves, and dispose them properly, and wash my hands, and reopen the curtains. I am going to the treatment room, to get the materials, then I will come back to do the dressing. Okay? Okay, nurse. Now, assessor, I am going to go to the treatment room. First, I'm going to wear my apron, wash my hands and don my gloves. I will assume that the trolley has been cleaned with soap and water for the last 24 hours, so I will use a disinfectant wipe to clean the tray. I will wipe the trolley from the furthest point to the nearest. After cleaning, I will remove my gloves and gather my materials. I will check the integrity of the pack, and check the expiration date, and check for any tears or precipitate. Now that I have my materials, I will change my apron, and take my trolley to the patient's bedside, by touching only the sides of the trolley. Hello, Mr. Calvin. I am back. Are you ready for the procedure? Yes, nurse. So I'm just going to close the curtains, to provide privacy for you, and have also closed the window, and stop the housekeeping activities. Okay, nurse. I will perform hand hygiene, and don my gloves. Mr. Calvin, I will now expose the wound dressing, then I will loosen the edges of the dressing. Is that okay? Okay, nurse. Now, I will dispose my gloves, then wash my hands. Then I will open my dressing pack onto my trolley. Wash my hands again, and open the pack, touching only the edges of the pack. I will wash my hands again, and I will take the yellow bag, touching only above the red line, and I will insert my hand, and arrange my materials properly. Then I will use the bag, to remove the dressing very carefully, and then reverse it, and stick it into my trolley. Next, I will take my solution, and wipe it with the alcohol wipe, for 30 seconds, and let it dry, for another 30 seconds, then I will open it slowly, and pour it to my small basin. Next, I will open my dressing pack, and put it into my sterile field. Next, I will wash my hands, and don my sterile gloves. I will then apply the drape, to the patient, and then using my right hand, as my sterile forceps, and my left hand, as my clean forceps. I will soak the cotton ball, squeeze the excess, then transfer to my left forceps using a septic non-touch technique. Then I will clean the wound with a single stroke and repeat as necessary. Next I will dry the wound with a gauze, picking up with my right forceps, transfer to my left forceps, using a septic non-touch technique. Then repeat as necessary. Since I will no longer need my clean forceps, I will dispose it to my yellow bag. I can see that the wound is clean, and there's no pus, or any signs of infection, which is good. Now I will apply the new dressing, making sure that the wound is completely covered. Now, I will take my drape hand, my materials, and put it into my yellow bag as well as my gloves and apron, and throw it into the yellow waste bag. Now, I will throw the packagings in the clear bag. I will wash my hands. I will recover the patient with his blanket and open the curtains. So how does that feel, Mr. Calvin? It feels fine, nurse. Great, so I will be at the nurse's station, documenting my nurse's notes. If you need anything, just ring the bell, and I will be right with you. Okay, nurse. Now I will return the trolley to the treatment room and clean it again with disinfectant wipes.